Charmaine Yoest is joining us. She's the co-executive director of the Heritage Foundation's National Coronavirus Recovery Commission. She's also the vice president of the group's Institute for Family, Community, and Opportunity. So, Ms. Yoest, just first talk about this commission, why you put it together, who sits on it, and then we can talk about, your recommendations.
Good morning, and thank you so much for having me. I really appreciate it. This was an unprecedented, historic crisis that we were all facing a couple months ago. And our president, Kay James, looked at the debate as it was developing and really became concerned that there was this dichotomy between people who were arguing from a health perspective and others arguing from an economic perspective. At this point, it's a little hard to remember how separated people were in terms of everybody needs to stay home or people go back to work. And we felt like it was important to kind of lift our heads up, look over the horizon and say, what's it going to take to talk about this issue holistically, about both lives and livelihoods? And so she put the commission together, and it was a fantastic experience and a great group of people of 17 experts from all across the country in all different areas and walks of life. We wanted it to be something, the National Coronavirus Recovery Commission, something that represented all different aspects of society. So we had people, obviously, from the healthcare sector. We had people who represented small business and looking at the economic issue, but we also brought in people who had expertise in education, civil society, disaster management, all these different components that made up the things that people were concerned about with this crisis. All
conservatives?
Oh, no. It was a bipartisan panel.
And your 5-phase plan that you came up with includes return to a more normal level of business activity, continue with CDC guidelines to slow the rate of new cases, increase availability of new diagnostic tests, reestablish more international travel and promote free trade, and reduce future risks of pandemics. Can you drill into the first one, return to a more normal level of business activity? Can you do that when Dr. Anthony Fauci says we're still in the first wave of this pandemic?
Well, whatever wave that we're currently in, and I think it is, and I think Dr. Fauci's point is important, particularly as we see people going out into very large gatherings, that the pandemic is still with us. We are still in the midst of it. What's different now than a couple months ago is that as this started, we didn't know anything about it. So we were having to really build from the bottom up and from ground zero. And what we are very fortunate to have now is a whole lot more information. Americans always rise to these occasions with ingenuity and resourcefulness and pulling together. And the science has progressed dramatically, and so has the data. And so what we know now is that this virus did not affect everyone and every place evenly. There were specific places that were hit harder. Everyone knows that New York City really, really had a tough time of this and is still not completely out of the woods. But one of the things that I don't feel like we've talked about quite enough is that who was hit hardest. Everyone does know that elderly people with comorbidities were much more at risk, but I don't know if anyone still fully understands how much more hardly hit than everyone else, people in nursing homes and other tightly living together kinds of situations were, particularly the nursing homes. And so as we move forward at this point, knowing these different data points, we can be much more strategic and more focused in how we approach the virus.
You also write, continue with CDC guidelines to slow the rate of new cases. I'm wondering what your opinion is then of President Trump holding this rally in an arena that seats 19,000 people in Tulsa, Oklahoma on Saturday when the CDC says we should avoid large gatherings.
Well, I think across the board, regardless of what event is being planned or what a person wants to be trying to decide about their vacation or about going back to work, we do have very specific guidelines from the CDC about how people can protect themselves. You can wear a mask. You should be following all the basic public health recommendations that we've all become very familiar with in terms of washing your hands and not and respecting social distancing. I went out yesterday to a store, for example, where we've got the markings on the floor now of how to stand 6 feet apart, protecting people behind cash registers with barriers. So we've come a long way in terms of being able to go outside and be together in gatherings with other people, and yet still protect ourselves and protect other people, which is what wearing the masks is really all about.
Why did the commission, those people that sit on the commission and you, believe that one of the keys here is increasing the availability of diagnostic tests? What did you find?
Well, you have to be able to know who has it and where it is. And so from the very start, that's been a challenge, right, of being able to see exactly where the virus is. And we've made a lot of progress on that, too, as well. So that's something that people can feel much more confident about as we're moving forward.
What states have met these recommendations that you have put out and are able to move forward with reopening without risking more cases?
Wow, I'm so glad you asked that question for 2 reasons. One, because I think if there's anything that has really been driven home throughout this crisis is the wisdom of having a federalist approach in our country and being able to make decisions at smaller levels than just the federal government. It was a very wise approach to say that the governors needed to be the ones who were making decisions about their own states, and frankly, not just the governors, but people, localities and communities need to be tracking the data in their own communities. We like to say that what's going on with nursing homes in New York City should not necessarily affect playgrounds in Montana. These are 2 very different scenarios. And so to specifically answer your question, at Heritage Foundation, we are tracking that question. And if you go to heritage.org, we have a couple of different maps there that people can click on to see their specific zip codes and what's going on in their community.
We'll go to Robert, who's in St. Louis, Missouri, Democratic caller. Robert, your question or comment about coronavirus pandemic and how the state and federal government have responded.
Yes, I'm calling in concern of how the coronavirus is doing, and also I want to talk about the book. Can I make a comment about the book?
Robert, let's stick to the coronavirus pandemic.
Well, I don't think it's going to be a while. I think it's going to be quite a while before we come back. We're suffering from it right now.
Charmaine Yoest, do you agree? It's going to be a while before we come back?
Well, Robert, thank you so much for that question. Good to talk with you this morning. I think that we need to be realistic about the fact that it's not over yet. We need to be prudential, we need to be smart, and we need to be targeted. Just because we're still facing this crisis doesn't mean we don't have some tools to help ourselves get back to work. One of the things that we found out through this whole process is that you really can't separate lives and livelihoods. Having over 30 million people out of work has been devastating, not just for the economy, but also for people's health. At one point, we found out that over 1 million people in the healthcare sector had filed for unemployment because we shut down all other healthcare other than focusing on coronavirus. But it turned out that our healthcare system was not overwhelmed by this, and we found that that other markers of health, of bad health outcomes were going up. For example, for years, we've had public health messages going to people to know what the signs and symptoms are of heart attack and stroke and some other things, and saying, as soon as you feel these symptoms, go to the hospital. And yet people became so fearful of going to the hospital that there are very bad outcomes for people who no longer feel comfortable following those guidelines. So that was part of the message of the commission, was to tell people that we've got to open up our entire healthcare provision across all of the different measures of healthcare challenges, and we need to get people back to work.